Hi, I'm Carol Higgins coming to you live from the Baptist Health Newsroom. Since antibiotics were introduced over 50 years ago, they've saved, no doubt, millions and millions of lives. But their reputation as a wonder drug has led to them being misused and overused. That may not sound like a big deal on the surface, but it really is an important public health problem that is going to affect all of us. So we want to bring you more information about that. We've got a couple great experts from Baptist Health here. I'm happy to welcome Dayana Mason, who is an advanced practice registered nurse with Baptist Health South Florida, and Tim Gauthier, who is the manager of the Antimicrobial Stewardship Clinical Program at Baptist Health.
It's a mouthful.
It's a mouthful. Thank you guys both for being here. Before we get started, I want to remind our audience to please go ahead and submit your questions throughout this segment, because at the end, our experts are going to do a Q&A and answer whatever questions you may have. So let's get started, and we're going to start with some kind of basic groundwork here. Antibiotic drugs, they are effective against bacteria, but not all infections are caused by bacteria, right? Oh. So there's viruses involved too. What's the difference that we should know between them?
So one of the big difference between microbial pathogens that are bacteria versus viruses is the infection types that they cause and how they cause infections.
Okay.
And physicians and diagnostic experts can differentiate when something is likely to be caused by a bacteria versus when it's likely to be caused by a virus.
Okay.
And so that's one of the big things that people should know is when you go to your doctor, you can let them, based on your symptoms, you can inform them of your symptoms, let them do a physical assessment, get some more information, and they can make a determination on whether that's likely to be a viral infection or a bacterial infection.
So what are some of the most common that people are familiar with bacterial infections versus that antibiotics will work on?
So there's a lot of conditions that actually antibiotics used to treat conditions such as sinusitis, urinary tract infections, ear infections, pneumonia, bacterial conjunctivitis, just to name a few. And those typically need antibiotics to help.
And on the other hand, what are some common things that we're familiar with that do not respond to antibiotics?
So, as you know, I work for Care on Demand. I'm one of the nurse practitioners there, and about, I want to say 80% of my cases are patients who actually have viral symptoms. So, as soon as they start with like the sniffles and that nasal congestion, they come and say, hey, I need antibiotics. And typically it's not really the case. They need to know that, common cold symptoms is different from a bacterial infection, okay? So the number one thing that we usually see is influenza. And patients who, have these influenza symptoms tend to think that they need antibiotics and they need antivirals, and there's a big difference between an antibiotic and an antiviral. Typically we use, Tamiflu within the first 48 hours that help the symptoms, that decrease and minimize the intensity and the duration of the symptoms.
So what if you take antibiotics when you have a flu? What is that doing to you?
It's actually hurting you when you actually take an antibiotic. When it's not needed, it's actually really hurting you. And that's what, we come into, drug resistance. That's how it comes up.
We will definitely get into the drug resistance later. But first, you brought up that you work for our Care on Demand platform.
Yes, I do.
I just want to bring our viewers up to speed. Care on Demand is a free app that you can download to your phone or your computer. And through it, you can have a virtual doctor visit with a medical provider. And it's just like you're in the office, but you can do it from anywhere and 24 hours a day. And that's where you can possibly meet Dayana. And also, we have a promotional code that's going on right now. I want to tell you, if you haven't tried it yet, it is FB Live. And that code will get you 50% off your first visit from now through February 29th. So back to our discussion. Go ahead.
Yeah, I also wanted to add, when you take an antibacterial or antiviral or just antibiotics in general, another thing that comes up a lot is when I have a positive urine culture. And just because there's a positive culture from the microbiology lab doesn't mean you need to have antibiotics. And so you need to ask whether or not the patient has symptoms or not and how they're doing at this time, because that could be an old culture or it can just represent colonization or contamination of that sample. And so just because you have a positive culture doesn't always mean you need symptoms. And again, patients should talk to their doctors about whether or not they need antibiotics and let the doctor make the decision what's appropriate.
How do you make the decision, Dayana, when it is a virtual visit and you really aren't able to do maybe some lab work? You're not able to swab them for the flu or for strep.
Okay, so a lot of times I have patients that complain of similar symptoms that can be bacterial or viruses. Typically I really get a good history. I ask them how long have their symptoms, what's the duration of their symptoms. Typically it takes about 10 days for a bacterial infection to, arise, or more than that. So I ask them, what have they taken? Have they taken anything to treat these symptoms? If they have, and they're still not getting better, and then they develop fevers, high fevers as in greater than 100.5, 101s, are they having facial pain or pressure? Are they having any green nasal drainage, any kind of dark sputum? So then I tend to typically say, okay, now we're going more towards bacterial. So that's when I'll typically try to treat them.
Okay.
So basically it's more of the duration of the symptoms so getting a good history is very important, especially because I'm virtual. I'm not seeing them, I'm not touching them. So, in my job, my field, it's definitely important getting a good history.
That sounds great. And you're very well trained to do that, right? You know what the answers to everybody's questions are. That's interesting that you say people will come to you on Care on Demand and say, I need an antibiotic. And they're not even listening to your medical professional. Let's go on to the subject that you brought up a little bit, was antibiotic resistance. Timothy, can you explain what that concept means?
So essentially, antibiotic resistance can develop as we use our antibiotic drugs. And so one of the things we say is the more we use our antibiotics, the more we lose our antibiotics. And so we really only want to use antibiotics when we really need to, that we can preserve them for the future. And penicillin was discovered by Alexander Fleming in 1928, and it wasn't really used until the 1940s. And in the 1940s, when Fleming was giving his Nobel laureate speech, he said, if we are not careful and we use our antibiotics when we don't need them, the bacteria will develop resistance and we'll lose these precious antimicrobial drugs. And so we've kind of gone down a path that we can take a corner here, but it's become a major problem because we use so much antibiotics that we're losing our antibiotics.
So those little organisms, those little bacteria, they are becoming smarter than our drugs? Or is there an easy way to explain how that happens?
They're outbeating the antibiotics pretty much, and they're growing and becoming stronger. So the typical antibiotic that you would use tends to not become effective, and that bacteria becomes resistant to those specific drugs.
Does that happen with all antibiotic drugs?
Virtually every single
one of
antibiotic.
them.
Yeah, even alcohol. There have been cases where there are viruses that have become resistant to alcohol. And that was usually one of my references of nothing becomes resistant to alcohol. And
but now it has.
Yeah, there are some issues with that, yes.
So in terms of the public health crisis that this is becoming, or many people have labeled it, why is it a crisis and what can we do about it?
So I can go into a little bit of a spiel,
Sure.
But why is there a problem, right?
Yes.
So the first thing is that the bugs are becoming more resistant.
Right.
We use more drugs, so we have more drug resistance. And the bacteria, we can cause them to become resistant as we use the drug in that patient who then has the bacteria in their body. But also those bacteria can share the resistance mechanisms between the same E. coli and the same E. coli, or even some of the different organisms can share resistance mechanisms between each other. And so the bugs are getting worse. From the drug development side, what we're seeing is that the big companies essentially left the antimicrobial drug development space. And so if I'm a pharmaceutical company and I want to develop a new drug, I want a drug that you take for the rest of your life or for a very long time so I can get a good return on investment.
Okay.
If I develop something like an antibiotic, a lot of them are used for short courses of 7 days, 3 days, maybe 14 days, depending on the infection type. And so that's a finite amount of opportunity I have to recoup the investment I've made into the research and development. And so it's really not a good return on investment in terms of if you wanted to develop an antibiotic for that reason. So we're seeing the bugs are getting worse. We're seeing that there aren't more drugs coming to the market. The drugs that have come to the market recently are kind of like Me Too drugs. So
what does that mean?
And what that means essentially is that it's a drug that has a similar mechanism to drugs that already exist. So we have classes of antibiotics, and we've developed more drugs within those classes rather than finding new classes and expanding those. And we've been punching into these bacteria, but we need to start kicking them and throwing nunchucks at them or these different mechanisms to attack them.
How does one go about? I mean, if it isn't a pharmaceutical company, maybe it's a nonprofit researcher or something who wants to find a new type of antibiotic. I mean, do they exist out there somewhere?
tons of research, I'm sure. It's going to...
Yeah, so it takes around $1 billion to bring a new antimicrobial from A to Z to market. And there are lots of molecules out there that can be investigated by drug companies, but you have to take it through all the different studies in animals and humans and clinical trials, and it takes a lot of funding. And so to give the pharmaceutical companies the motivation to go through that, we really need the financial incentives.
Okay.
Otherwise, they can't do business, right?
Right. So I'm hearing you talk about like responsible use of antibiotics being something that's important.
Definitely.
Antibiotics, as much as we all want to, have an instant wonder pill to cure something, they come along with a lot of side effects too, right? What are some of the side effects? I think we have a graphic that we can show and talk about as well that come along with taking antibiotics.
So when antibiotics, they're used to kind of kill the bad bacteria. They also hurt the good bacteria. So, some side effects that you'll come into contact with is like, diarrhea, nausea, loose bowels, which sometimes can develop into like Clostridial difficile, which is C. diff, which is, a really bad
What is that,
bacteria.
C. diff?
C. diff. It's constant pretty much diarrhea that actually has to be treated with antibiotics at the end of the day anyway. So.
Oh, wow.
Yeah, so Clostridium difficile is an organism that can cause infection, and you can actually be colonized, or it can live inside your gut, and it can live there and you can be totally fine. But if that organism is there and you take antibiotics, it can kill some of the competitors that C. diff has, and it can cause diarrhea. And when you have those symptoms of infection and the presence of C. diff, many times it is required to treat it. And virtually every single antibiotic on the market has a potential to cause C. diff. And this is different than other drugs, because if you take a cholesterol medication, it's not working on bacteria.
Right.
Antibiotics are working on bacteria. So they have more risk than other drugs in that capacity because they affect the microbes that live in our bodies.
Right, so it's not targeted to just those
not the bad ones, but it also hurts the good ones.
It can also hurt the good ones.
Exactly.
So that's another reason why we don't want to be so anxious to just go with the antibiotics.
Definitely. I think another way of like how to stop this like widespread issue of drug resistance is definitely having patients kind of take accountability of their own health. As soon as those symptoms of like the nasal congestion, the cough symptoms start, go to your local pharmacy, go and start using, your Mucinex DM, your Flonase, all the different kinds of medications that are out there that actually help these symptoms. Because like I said, viruses can take up to 7 to 10 days until you start to feel better. So, after 10 days of using those medications, then contact your primary care doctor, have a virtual visit with me, and we can reconnect, and we can see possibly maybe antibiotics might be the drug of choice for you at this point. But I've also known that you've taken everything and you've done everything at that point to
so
feel
you've
better.
Eliminated that as a possibility.
And as an antibiotic expert, I'm very concerned when my family members or myself or my children have to take antibiotics, because I know all these side effects, both what can happen to your body or from the diarrhea standpoint. And so it makes me very nervous, and I'm very cautious about when I'm okay with giving my children and my family members antibiotics. And when we do that, I want to make sure they also get the right duration of therapy. And so every day that I can avoid, if it's unnecessary, I want to avoid that. And so that's another question to bring up with your healthcare provider is, how long do I need to take this for?
Antibiotics for. If you're feeling better, and you decide you don't want to take these antibiotics anymore, call your doctor up, have a virtual visit with us, and we can, see what's the next treatment plan for you, if you need to finish the duration or not.
Because that is one thing that I know over the years when I've gotten a prescription for antibiotics, they're always saying, take all of them, take the whole course of them, but I should feel free to ask questions if I'm feeling better in a few days.
Exactly.
Is that what you're saying?
Yeah.
Okay. And what about parents of children? Do you have any specific advice for them?
That's a challenging one, because obviously I'm a parent and you don't want to see your child sick. However, I want to say maybe 8 times out of 10, all these viruses typically rise up in children, especially they're in school, they're in daycares, they're all passing all these viruses and infections to each other. So it's important for parents to also, be responsible to treat these symptoms. If you see your child having nasal congestion, runny nose, go ahead, give them that nasal saline. Use that nose free to suction it out, because obviously that's the only way to get rid of some of those, symptoms. So definitely parents need to take accountability also and do the work.
Right.
Take that snot out.
One of the strategies that a lot of providers use is called shared decision making. And that's when you take the information from the patient and then you do your physical assessment and you combine that to make your diagnosis. And that shared decision is made with the patient about what's the appropriate course based upon the diagnosis and the information you have. And from a parent side, it's important to bring as much information to the provider that you can, because the patient's not going to be able to tell you, where the pain is, or if they threw up, last night or something like that. So keeping an accurate record and a history with some of that detailed information and what's worked in the past for the child is something that is critical.
That's great, yeah, because they have that information that the physician doesn't.
Exactly. We really need patients to trust us because we have their best interests at heart. If we say no, we don't think an antibiotic is necessary, it's because we really think it's not necessary and we don't want to harm you. And I mean, obviously, my goal is not to harm my patients, it's to make them feel better. So, we have their interests at heart and we really need patients to trust us. Like, we're the medical experts and, we're trying to give you the best treatment plan as possible. Avoid harming you.
Yeah, and as you go to your medical expert, your licensed healthcare professional, you may have information you found on the internet, and you really need to be cautious about the information you find.
Right.
Dr.
Google. We talk about Dr. Google a lot. Yeah.
And it's there's so many cases where students have come to me and they say, oh, Dr. Gauthier, I found that I might have prostatitis, and I'm like, well, you're a female. It's not gonna happen. So be very cautious about what you read on Dr. Google.
That's very important. We emphasize the same thing in our communications, definitely.
Absolutely.
Well, we do have a few questions from our viewers, so let's go ahead and start with them. Is it okay to use my wife's unused antibiotics if I feel sick?
Absolutely not, I think.
Everything in the world of infectious diseases, the answer is almost always it depends. If you're not sure, then don't
always
do it.
Consult with your primary care doctor, or reconnect with us on Care on Demand. Definitely.
So don't just assume.
Don't just assume.
Yeah.
There's a couple of reasons why. Number one is it may be the wrong tool for the job. And so antibiotics have a different spectrum depending on which one you're talking about. And by spectrum, I mean the different types of bacteria it kills. And so if you have a gram-negative infection and you're using a drug that's for gram-positives, you're missing it. And so you're putting yourself at risk for toxicity and for diarrhea, but you're not going to help yourself.
And you're not treating exactly what's going on.
So I've noticed that over different years, you get one kind of antibiotic for, let's say, a urinary tract infection and another one for your sinus infection. Is that what you're talking about here?
Yeah.
Okay, certain kinds of antibiotics are better for different things?
Yeah, because they penetrate through the different bacteria. So that's why you have to really
more
know
targeted.
Exactly.
Okay.
You have to really know which bacteria you're treating and targeting.
So, and not only is it the bacteria that we're trying to target, but it's also the infection site. And so some drugs, for example, like nitrofurantoin, it gets into the urine really well, but it doesn't get into your sinuses.
So don't.
Right.
Yeah.
Same as like a Z-Pack,
Okay.
Obviously I get tons of calls, patients requesting Z-Packs. Yes, it's a short course of antibiotics, and yes, it helps the respiratory tract, but you can't treat a Z-Pack that you have left over to treat your urinary tract infections. It's just not going to work.
It's not one size fits all.
Exactly.
When antibiotics are concerned.
I think it has to do a lot of education. We, as medical experts, we have to educate our patients about these problems. So.
Yeah, another thing that if you have antibiotics left over or any drug left over is that they expire over time.
Right.
And what that usually amounts to is the efficacy or the ability of that drug to work can be reduced because of the drug stability. And so you don't want to take a drug that's not going to work.
That's true too. That's not helping you at all. Let's see, we also had a question about probiotics. Should you take probiotics while you're on antibiotics?
It's really up to your discretion if you want to, right?
Yes, in my experience working with various clinicians in various settings, it depends on the patient case and what's going on. And so the literature in general is a bit indifferent to whether or not probiotics help. I don't think that they hurt.
They don't hurt,
very
definitely.
limited
They don't
risk.
hurt, so it's not like taking somebody's leftover antibiotics.
Correct.
It's not going to hurt your. So maybe if it's something you feel it might help you.
Well, there are two risks.
Okay.
One of them is in patients that don't have immune systems that work really well.
Okay.
You can actually get an infection with that probiotic,
Oh, dear.
and that's been documented, which is very specific to that population. Another thing is cost. And probiotics are not free, and that can hurt your wallet. And so if you're making the decision between something that you need on a monthly basis and a probiotic, that can be considerable. And so those are the reasons I kind of put a pause before I say give it a probiotic.
Okay.
However, most people can take one, and it shouldn't be a major problem.
Okay, but like you always say, and like we always say here, this is general advice. It always depends, and talk to your medical provider
It depends.
because everybody's an
Case by case.
individual.
Yeah.
Exactly. One more. can I have a drink while I'm on antibiotics? Wine, beer, vodka? And as well, I guess I'd like to ask, there's something about dairy and antibiotics interacting too, or is that a myth? Let's talk about alcohol and then dairy.
I can talk.
Alcohol. Okay.
So it depends.
Okay.
So for example, there's a drug called metronidazole or Flagyl, and that drug can cause what's called a disulfiram-like reaction, and that's when you experience significant nausea and even vomiting when you ingest alcohol while taking this medication. And so it does depend on the safety. The safety of drinking alcohol depends on what the infection type is and what drug you're taking and how sick you are. Because of course it can also alter your ability to do other activities, and your ability to maintain hydration may not be where it is if you're altered mentally from taking alcohol.
That makes sense too. What about dairy? Is there anything to that?
It's kind of like a case by case with dairy. Certain antibiotics, the calcium that's in dairy binds and it doesn't absorb very good. So that's another reason we would say sometimes, depending on what antibiotics you're using, I think the main one is like tetracyclines.
Yeah, so tetracyclines, right, can have a problem with absorption, and same with some of the fluoroquinolones like ciprofloxacin or Cipro and levofloxacin or Levaquin. And what happens is when you take that drug and you ingest it, the calcium or some of the different cations or positively charged molecules can bind to it, and when they bind to it, they prevent your body from absorbing it. And if you don't absorb it, it's not going to
really worth it.
It's not working.
Do those labels generally, or medicines usually come with a label that says don't interact? Okay, so read your labels.
Yes.
That's the answer for that.
Yes, and talk to your pharmacist if you have questions.
That's right. How helpful can pharmacists be for this?
Yeah, I think pharmacists pride themselves on being a trusted resource for their patients.
Definitely. Even for medical experts, we always go to our pharmacists.
And we talked about using therapy that will treat the symptoms that you have.
Right.
And pharmacists are really good at that. So when you go to an outpatient pharmacy, you can ask those questions. If I have a snort, I have a sniffle, what can I do for that? I have some pain, I have some congestion. What is a good therapy for that? And the pharmacist can really help you, especially a pharmacist that has access to your medication regimens, because they can know what drug interactions to watch out for.
Exactly.
Oh, that's important too, right? Because can over-the-counter things that you take, can that interact with these drugs?
Absolutely, especially patients with high blood pressure. We tend to tell them stay away from, decongestants because that will raise your blood pressure. So if the pharmacist is there and they have access to your medical records and your drugs, they definitely can, steer you away from those medications, because there are medications that are over the counter that can help with those symptoms that are for patients who have high blood pressure.
Okay. I think we have one more question. What do I do if my doctor doesn't suspend my antibiotics? If I call him or her telling them that I feel better?
Always follow their advice.
Follow their instructions?
Yeah, so there are some scenarios where you really need to continue your antibiotic depending upon the case. And so even if you feel better, it may be critical for you to continue to take that to prevent yourself from becoming worse. And so the message that we really want to get out here is that listen to your healthcare provider when you have a decision of do I need an antibiotic or don't I need an antibiotic, because they're the expert. Right.
Well, we are coming to the end of our time, so I'd like to ask you both to leave us with a final thought, if you would, Dayana.
I would say definitely trust your medical providers. We have your interests at heart and we want what's best for you. We want no harm to be done to you. So definitely always listen to your healthcare provider. And also connect with us on Care on Demand.
Yes, for sure.
Yeah. Yeah, and really to echo what you're saying is, when you go to your provider, don't go asking for an antibiotic. It's okay if you think it's the right thing and that's what you need, but make that decision with your healthcare provider. So go with the expectation that you're going to have a conversation, and you may leave with one, you may not.
Right.
Exactly.
Right. But they are, like you said, we were talking earlier, you said if you go to a mechanic and they tell you need an oil change, don't go home and change your tires.
Yeah, you trust them, and then he's like, you need this. You trust what he's saying, so you do what the mechanic says. So it's almost same thing with your healthcare provider. We have your interests at heart. We want what's best for you.
Terrific. Well, thank you very much. Very good information. I appreciate you both joining us today.
Thank you so much.
Thank you.
And thank you guys for watching and submitting your questions. We always love it when this is interactive. I want to remind you that we have a great source for more health news and information. That is our blog that you can reach at baptisthealth.net/news. And also, please follow us on our social media channels. You're going to see the handles on the screen right there for Facebook, Twitter, Instagram, and in LinkedIn. LinkedIn, Carol, LinkedIn. Thank you very much for watching today. It was our pleasure, and we'll see you again next time.